Tip number 1, recovering from shoulder surgery is a great time to grow a beard. Alright, so in another one of my videos I talked about how I really like to eat yogurt, and it's a bit of a challenge to do that in a sling because the yogurt cup kept falling over and move all over the table, so Jenny had to come and hold it while I was eating it. So I came up with a life hack. Now first of all, hopefully you're picking a good quality yogurt, like a Greek yogurt or something that's low in sugar. Some of these things can be packed with sugar and stuff that's not good for you. So first of all, make sure you're reading the label. But what I came up with is a little life hack using a mug. So what I can do is I can take this top off with one hand. It takes a little bit of practice, but it's not too bad. Just like that. And I put it in the mug like that. And then now the weight of the mug will hold the cup there, so I can now stir up my yogurt and eat it without it sliding all over the table. Now this also works with different sizes of yogurt cups as well. This is a silk yogurt, which is a lactose-free yogurt, but you can put that into the top and it'll hold it as well. And since it's very difficult, and you can hear Cammie growling in the backyard, and since it's also difficult to eat grapefruit one-handed, I've gone to grapefruit in a cup. Now this is packed with just water, but it's the same thing. You can put that in the top of the mug, peel the top off, and it'll keep it from moving all over on you. So it's also very difficult to floss your teeth with your arm in a sling. So Jenny went out and got me some of these. They're called floss picks, but it's basically just a stick with some floss strung between two ends, and then there's like a toothpick on the other end. But this way I can floss my teeth with just one hand and don't have to worry about cavities while I'm in this sling. So in my other videos you saw me in this blue sling, and this is what they put me in after surgery. And for the first couple of weeks it was okay, but the longer I wore it, the more it started digging in on my neck, especially as I started walking outside and getting around more. And the straps also started pulling on it, and so it just got to the point where it wasn't very comfortable. And one of my other videos I was talking about how my forearm was bothering me as well, and I think it was because of that brace. And so I went out and I did some research on Amazon. I wound up getting this one. This one is pretty expensive. It's over $100, but it's well worth it. I figure I'm going to be in this thing for over 6 weeks, and so I want something that is comfortable and I can get up and walk around in. It did take a little bit to figure out how to get into the thing and to get it adjusted properly, so Jenny had to help me get all the straps and everything adjusted right. But what I like about it is that the cushion between my arm and my body is a lot softer. There's also a Velcro strap that comes back here by the elbow, so it keeps my arm from sliding forward. Unlike that strap, as the sling would start coming down to my side, my arm would have a tendency to start sliding out of the sling. So this one does a much better job of holding my arm in place. Plus it also has a thumb strap right here as well, again to keep your arm where it should be. And then there's a place that you can put a stress ball. Here it's just tied on with Velcro, so I can take this out, undo the straps, and do my arm exercises and put everything back in. So it's worked out really well. As far as taking it on and off, I found that it's best to let gravity do the work with my arm. And so if I take these straps off here, and then I'm going to undo these buckles, and I'll show you how I get out of this thing. And I'm going to buckle this one here. I'm going to lean forward and just let gravity pull my arm away from my body like that. And then that way I don't have to use any of the muscles in my shoulder to bring my arm up and move the cushion out of the way. So I just do that leaning motion. And since I have the brace off, I'll go ahead and show you too how I can take a shirt off. Now I'm wearing extra large shirts. I normally wear a medium. And so this shirt I think is a large. I've also worn extra large shirts. It's just easier to get in and out of, especially if you're by yourself. But what you can do is you can take one arm, and if you're coordinated enough, bring it through. This one's going to take a couple tries, like that. And then I can take this side off, over my head, and then down on that side of the arm. And then to put it on, it's going to be the same thing, only in reverse. So first of all, let me make sure I got this right. So I'm going to start with my right arm again. I'm going to lean to my right and then find that sleeve, bring it up as high as I can, stick my head in, and then the other arm just like that. And that's how I can get my shirt on and off. So then to put the sling back on, I'm going to grab it with the straps that go underneath my left arm. And so I'm going to put this on first like that, and then I'll swing it around behind me I can kind of grab it with my left arm, bring the strap down, lean forward, get the cushion in place, and then stand up again. There we go. Stand up again, bending my arm at the elbow. Then I'm going to do this strap first around the elbow. That kind of holds it in place. And then I can grab the strap from behind, anchor it to the cushion, like that. And then I found that there's these two buckles here, and it's easier if you buckle the bottom one first. So I'm going to put this one in. Like that, and then now I can get to the top buckle. So now I can get to the top buckle, like that. There we go. And I'm going to end it by putting my thumb through. So again, I really like this sling. I'll put more information about it down in the description. Now you might want to talk to your surgeon ahead of time and find out what kind of sling they have planned for you after surgery. I also read online where a few folks bought this in advance and they took it with them for their procedure, and then the operating staff put them in their sling before they came home. So if the surgeon doesn't have anything like this, if they're going to put you in just one of the standard slings, you may talk to them to see whether or not that's an option for you.
One of the videos we watched before Ken had his surgery talked about a lady who was getting her husband ready for his surgery, and they cut some shirts. So I got some undershirts for Ken. These are Hanes brand, V-neck. Figured that way it gave a little bit more neck space. And then the arm that he was getting the surgery on, I cut down the sleeve and a little bit more than halfway down the side. That way it gave him plenty of space to get it around the surgery arm, around the brace area, get it up over his head so he could actually wear a shirt.
And this was really beneficial for me the first time that I had to put a shirt on. I had to go 5 days in the dressing, and so it was a long time. And so not being able to move my arm much at all, this really helped get the shirt on and off. Okay, so it's been roughly 5 weeks, and it's time for physical therapy. So we're on our way now to my first physical therapy session. There's Jenny. Say hi, Jenny.
Hello.
My chauffeur once again. So once we get there, we'll see whether or not we can video any of this. Otherwise, we'll let you know how it goes afterwards.
Do you have one incision here in the back and at the side?
Yeah.
Okay. Any tenderness? Okay. And back here.
Right in there, and then right on top.
Okay.
Here.
Also, but nothing when I'm pushing it right now,
Not
right?
when you're pushing, no.
Okay. Yeah. So a lot of the times when you're in the sling, the pec gets really shortened and tight.
Oh yeah, because the shoulder rolls forward.
Your shoulder. So once we're cleared to do a little bit more of the shoulder, we're really going to work on opening you up and getting that loose and digging kind of into that muscle. So a lot of your muscles are going to get really tight and tender and angry at first. And then same thing with the upper trap sometimes. It's nice and tender. Okay, anything down in here?
No, I do notice every once in a while a little bit of pain right here.
Yeah, so deltoid tuberosity, it just so happens that a lot of shoulder patients get referred pain into the deltoid. I mean, it is your prime mover of your shoulder. And so as you start moving it more, you'll probably get a lot more pain down into here and less in the joint itself.
Okay.
But that just, site of referral, I'm not sure why the tuberosity specifically, but it happens very often. All right, so we're gonna move your arm. I want you to relax it, let me move it, okay?
Okay.
All right. Let's see what we got. You okay there?
Mm-hmm.
Right about there.
Yeah.
Okay. Move it around first before I take any measurements. Is it just soreness? You feel like it's a pull? What are you feeling?
It feels just soreness.
Okay.
A little bit of a pull once you get to there.
Up to the top. Okay.
Yeah.
So,
I'm kind of feeling that really not like the bicep tendon as you pull it out.
and he did no work on the bicep tendon, correct?
No.
Okay. But, so the rule of thumb for this is it's not no pain, no gain when it comes to rotator cuff surgery. We use that kind of as our guideline. Soreness which you're probably used to since you work out a lot. You know what muscle soreness feels like, so that's okay. Once we start getting that sharp shooting pain, that's when you need to say, okay, that really hurts, and then we won't go past that. We'll back it off from there. It's a nice balance between moving the joint so it doesn't get frozen, but also making sure it heals properly. You'll also know that you're probably going to get more pain coming down than going up. And that's because, you teach fitness classes, right?
Yeah.
So are you familiar with concentric and eccentric
Yes.
control? So the eccentric control component is what's going to kill you more, because the effort it takes and the control and strength it takes to lower that moving part is pulling on your muscle a lot more. So always coming down is a little bit worse than coming up. So you're at 67 degrees for some flexion. So we're going to come out more towards your side. We're going to go first in an angle. We're going to come up this way. Is that okay?
It's really hard not to engage any muscles.
I know. It's going to be a struggle. So for the first couple of weeks, you got to think, relax, let it go, let your arm get heavy in my hand. For being immobilized for 4 weeks, this is pretty good. That is really great pain tolerance.
Yeah, pain tolerance is what gets me in trouble.
I think that's what it's going to be. We're going to bring your arm out here. Is that okay?
Yep.
Alright, we're going to bend your elbow, and we're going to come close to your stomach. This way. How does that feel?
That feels a little tender.
Yeah. It stinks because one more functional movements to rotate your shoulder.
Right.
So right about there.
I can go further. Right there.
Go out. Just want to see if you have full. So you're lacking just a little bit here. And that's from being in the sling. So I'm just going to do that. How does it feel to extend it out? Any pain?
When I first take the sling off, it stretches and then it's fine.
You can relax. Okay, I just want to see what is good. That's pretty good. You kept a hold of it. Good. No pain?
No pain.
So it's more so into extension. We're not getting the full.
Yeah.
So we'll work on that. Okay. Hand down like this. We're good. Going up and down. Good. Alright. So the hand itself is looking pretty good. Alright. Just sitting there, I'm going to check your posture. So just sit like you normally do.
So I'm slouching
Yeah,
down,
there you
posturing
go.
this like, okay, yeah, this is
Sit
how I
like
normally
you
sit.
normally do. At the
I'm
computer
probably
desk.
more like this. Yeah.
Okay, I'm gonna feel around where your shoulder blades are, okay?
Alright.
Can you move your left arm out to your side? If you're bringing it up, yep. And back down. One more time. Okay. Relax. Squeeze the shoulder blades together, hold 5 seconds, and then relax. Just working on some scap stability with mid traps. And just to kind of get that started a little bit, and then we'll tease out and do specific muscles from there.
Okay.
And then 3 of your pendulums. So one of them we do a little bit differently than the other ones you're probably familiar with.
Okay.
So I'm gonna have you stand up, and I'm gonna raise this bed. So you're gonna lean your right here, left arm is gonna hang, and the first one you're gonna rock back and forward and back. So all your body weight is just going to go forward and back. Yep. So trying not to actively move your arm too much, but yet letting your body weight just swing it back and forth like that.
Okay.
Good. So there's the forward and back. I'm going to have you do it for 2 minutes, 2 times during a set, and then twice a day.
Okay.
Okay? And that's all written in here. The other one are your circles. So you're going to circle your body around. Good. You're going to go one way 2 minutes, and then you're going to go the opposite way. So go ahead and reverse.
There you go. How's it feeling?
Real stiff.
Real stiff. So if you want to do it more than those 2 times, then you're more than welcome to. Use pain as your guide if it's starting to get pretty painful and it's not just muscle soreness. Back off. Again, it's not about no pain, no gain. You gotta let it heal, okay? The last one, so you're gonna turn with your thumb up like this. You're gonna be in a 45-degree angle and you're just gonna bring it up. So this time you can move your arm. So you're gonna move your arm into a 45 and then back down. So you're going just as high as you can tolerate. If you get too much pain, then you're gone too far.
Wow.
Yeah. So we call this scaption, or your scapular plane.
Okay.
That's where your joint is most open, so you're not damaging anything. It's the safest plane to move in for now. So you'll just do that for 2 minutes as well.
Oh, that's disappointing.
Well, it's also been immobilized for 4 weeks. Would not be too hard on yourself.
Okay.
All right, any questions?
No.
Any really sharp shooting pain when you do that, or just a little bit of
just
soreness?
primarily soreness. I mean, there's pain, but it's
Okay.
not sharp stabbing pain.
Okay,
so.
good. So make sure you ice after working it.
Okay.
I know that you're probably not going to want to, but I would suggest that you ice after doing any of your exercises, at least for the first couple of weeks, because it is healing still, and so you don't want to get all that inflammation or anything in there.
Yeah.
Icing would be a good thing. Another thing, I know you have a high pain tolerance, but you might want to consider taking something over the counter before coming to therapy,
Okay.
just so you can tolerate some of the moving of your shoulder a little bit better. Try without it the first time, and then if you think you need it,
Okay.
take it.
All right.
Okay?
Okay, so that was pretty cool. I really enjoyed getting my arm out of the sling. I actually, it wasn't that bad having them test flexibility and the mobility of my arm. I didn't mind that so much. Got a little painful sometimes there toward the end, but it just felt good to get the shoulder moving again. And they gave me some exercises to do, basically pendulum swings. I've got 3 different variations of those to do. And then where I just squeeze the shoulder blades back as far as I can, like you're holding a pencil between the shoulder blades in the back. So I do those twice a day, 2 minutes each. Right now, I'm going back to the physical therapist 2 times a week for the next couple of weeks. I'm really looking forward to doing these exercises on my own and getting more mobility back into my arm. So we'll see how things go over the next few weeks. If you like this video, please let us know by hitting the like button. To find out more about KW Fit, you can visit our website at kwfit.com. You can also subscribe to our YouTube channel to see more of our behind the scenes and fitness videos. Thanks for watching.